I want to reflect a little bit first on how demography has become important during the pandemic, and also reflect a little bit why did I become a demographer. So as Gil said, I have training in demography from El Colegio de Mexico, where I did my master's. Then I did the European Doctoral School of Demography in Rome, and afterwards I did my PhD at the University of Southern Denmark, where I'm speaking from today, and now I'm like based in the Leverhulme Center for Demographic Science at Oxford. And this journey became with the fact that I was asked back then to do the population projections for Mexico, or try to replicate what the Population Council of Mexico was doing. And I decided to enroll myself into a demography program. And when I was doing my demography program, there was this sense of increased violence in Mexico and in many Latin American countries, but I was particularly attracted to the fact that demography could aid on our understanding of what have been the cumulative impacts of violence in Mexico through different mechanisms, different demographic indicators, but also using demographic tools to come up with reliable mortality estimates in countries where the data might be deficient or may lack quality. So as I speak about violence, then I became interested in how violence as a structural social change is affecting population health. And I was particularly also interested on how we as demographers, like once I fall in love with this discipline, I was asking myself, how can we use demographic tools, demographic analysis, to understand or quantify what is the cumulative impacts of these structural social changes? So in that sense, one of my first challenge back then was to quantify, for example, what was the effect of homicides on the stagnation that we observed during the first decade of the 21st century in Mexico, and also how does this explain, for example, violence and life expectancy trends in the more broader Latin American context. And so from that perspective, it is clear that demography can help a lot on understanding these long-term, but also kind of shocking structural social changes. And in 2020, with the COVID-19 pandemic, we see another structural change in our societies that will affect and is affecting population health, mortality, and potentially also other demographic factors. So then demographers we are fully prepared to aid and provide tools that will help us understand what are the consequences in the medium term, and in the long term of the pandemic in different demographic variables, including mortality, fertility, and migration. So I felt that demography was very well placed as a discipline to provide insights into what is going on with the COVID-19 pandemic. And I was reflecting about this in the last couple of weeks. And I remember the seminal paper by Ronald Lee, Demography Abandoned Its Core, where he explained how he was told by NICHD high-level staff that formal demography was in a coma and that perhaps we should just let it die a natural death. And this was written 20 years ago. And I think if anything, if we can take a positive thing about the COVID-19 pandemic, is that demography matters, and that demography has become one of the quite important social science disciplines in understanding the COVID-19 pandemic and its effects. So if anything, the COVID-19 pandemic has made demography shine as it hasn't in the last couple of decades. And also there is a renewed interest on demographic science due to the fact that we can provide quite important narratives about the COVID-19 pandemic and its impact on different contexts. So demographers and epidemiologists during the last year and this year and still ongoing efforts are interested in quantifying, for example, an indicator that is known as excess deaths. Excess deaths are defined as the difference between what we observe during the pandemic against what would have happened in the absence of the pandemic. So this difference is a very good indicator, it's a good thermometer to know how the pandemic is evolving, for example, in a weekly basis or in a monthly basis, because it overcomes some of the limitations about testing strategies, the different strategies between countries, but also the capacity of testing. So earlier this year, we published our paper on quantifying excess deaths in England and Wales for most of the weeks of 2020, as editor's choice in the Journal of Epidemiology and Community Health. And as demographers, then we're almost usually interested in at least two dimensions. We're interested, for example, in how this will differ by age groups, how it will also move in a temporal dimension. So age and time are dimensions that demographers feel very comfortable on including in our analysis. So we came up that by 2020, there were an excess of almost 68,000 deaths or individuals that very sadly died during the COVID-19 pandemic, in excess of what it was expected that year. And like I said, as with demographers, we need to include the age dimension. So we simultaneously model age and also temporal changes using GAM models. So these are models that are quite more complex than the usual models that are used in the public press, like the 5-year average and so on, because then we can model sex, for example, sex differences and different age groups simultaneously. And what this graph is showing is the cumulative excess deaths in 2020 by different age groups. So we can see that in most age groups below age 85, there were higher excess deaths among males, and then in the group above 85, there were more excess deaths among females, which is expected because females survive to higher ages. So the population above 85 is predominantly female than male. Now, reflecting on what excess deaths mean, this is a very common indicator among epidemiologists, among demographers, and nowadays, I think many people are quite aware of this indicator. And it is very useful, like I said, because we can track more or less the evolution of the pandemic. It also overcomes some limitations, including the different testing strategies, coding practices related to COVID-19 deaths, for example, in which case then we can also overcome the potential undercounting coming from the lack of classification of COVID-19 deaths. And then if it's modeled properly, we can account for population age structure and population aging or population change. So these are all the nice things about this indicator. But as any indicator, it is not perfect. And one of the limitations that I see in excess deaths is that it's very difficult to make comparisons. So it's a very good indicator to track in a population what's going on, but it's very difficult to compare between subpopulations because populations differ in their population age structure, in their population sizes. So if you have different population sizes, also metrics of uncertainty can be affected by the population size, including, for example, Z-scores. So facing this challenge of comparability, the demographer's perspective kicked in. And working with our team in the center and here in Denmark, we thought that there was a need at that time of going beyond excess deaths and country-specific analysis, and instead provide a comparative perspective in a cross-national way that included many countries. And how can we do this? So there are plenty of indicators that we could have chosen, and after really thinking about what would be the best one in our view, we ended up calculating life expectancy. And life expectancy, first I want to start by also providing a definition of what it is and what it means, because it is quite misinterpreted in the general public and in the news. So life expectancy is this indicator that we take from a life table. And life table is this model that demographers are in love with, that we have worked so much in developing and in understanding. And life expectancy at birth or at some age expresses then the number of years that a synthetic cohort of newborns could live if they were to experience the death rates observed in a given period, usually a year, throughout their lifespan. So what this means is that it's not a projection or a forecast of any individual's lifespan. It provides a snapshot of current mortality. And the reason why we love it so much as demographers is because not only it is one of the most widely used metrics in population health research, is because it is comparable across countries and over time. So it is not affected by changes in population size or population's age structures. It only reacts to changes in mortality. It also summarizes the mortality in a given year, so it is a measure of average mortality in some way. But most importantly, demographers have been obsessed with being able to disentangle what are, for example, the age groups contributing to a decline or an increase in life expectancy, or what are, for example, the causes of death that are driving changes in life expectancy. So demographers have developed this subfield of demography that is called the compositions. And with these tools, then we can use them to decompose what life expectancy, what changes are driving life expectancy, and what underlying mortality patterns may be underpinning these trends that we observed. Now, in order to calculate life expectancy during the COVID-19 pandemic, then we also need to overcome other challenges. Well, the first one is that we need timely all-cause mortality data. If we don't have timely all-cause mortality data, then we cannot calculate life expectancy. Thankfully, a group of demographers and researchers at the Max Planck Institute for Demographic Research have these ongoing efforts gathering all-cause mortality data disaggregated by age groups and sex for many, many countries. Now, not all countries report all-cause mortality data with enough disaggregation. Hence, that we could only analyze a bunch of countries and not all of them. Similarly, in low to middle income countries, oftentimes all-cause mortality data is reported with a lag of time quite considerable. So it is not uncommon that the data is reported 1 year after, or in October of the next year. So this is a limitation that is very difficult to overcome. Another concern that we have as demographers is the quality of the data. So while, for example, the Human Mortality Database provides data for mostly high quality, well, countries with high quality data, the rest of the world does not fall into that category, which means then that we cannot just use that data. We need then to provide, firstly, reliable estimates of age-specific death counts to then introduce into our life expectancy calculations. And we also need this data, like I said, to be disaggregated by age and sex at the very minimum in order to construct life expectancy. And finally, once we have our deaths information, we need also population estimates to use as denominators. And for this, locally, there are plenty of sources, including, for example, the World Population Prospects from the United Nations. So we used all this data and overcome these challenges to come up with life expectancy estimates for 2020, earlier this year, for 29 countries. Now, the reason why the talk is titled "In Low Mortality Countries" is because most of these countries would be considered low mortality countries or high income countries, which is, of course, one of the limitations in terms of how many countries could be included, because those countries that usually have low mortality have also better statistics systems. So just to put it out there, there is a need from low to middle income countries to provide this data, but also we need to face the challenge that we will need to work with this data first to have reliable estimates of mortality if we want to then include much more countries apart from just the high income. So we published our paper in the International Journal of Epidemiology, and it was widely taken by the popular press. It was covered in many news outlets. And like I said, in many of these news outlets, there was a misinterpretation of the concept of life expectancy. So that's why I wanted to introduce it first. And this is the first figure that we came up with. This figure shows life expectancy at birth in the left and life expectancy at age 60 for the 29 countries that we analyzed in the original paper. And each symbol represents either 2015, 2019, or 2020. And I think from this, before going into how the life expectancy changed, I think we can notice at least two remarkable observations. One is that, as is well known, life expectancy is larger among females than males in all of these countries in a given year. But we can also observe that there is even quite a heterogeneity between the levels of the countries. So we go from countries that have male life expectancy below age 70, in life expectancy at birth below age 70, for example, here in Lithuania, to the highest female life expectancy that we observe nowadays in Spain, with over 45 years of life expectancy at birth. Now, the patterns between life expectancy at birth are quite consistent also with life expectancy at age 60, which is not entirely surprising because a lot of the action, a lot of the mortality nowadays in these countries is occurring above age 60, because they have already reached quite low levels of infant mortality, and to some extent also midlife mortality is low in some of these countries, not all of them, Scotland being an exception, for example. So we were interested in analyzing how did life expectancy change between 2019 and 2020, and compare this to previous years. For example, how did life expectancy change between 2015 and 2019? So what this graph shows the change between 2019 and 2020 for life expectancy at birth and life expectancy at age 60. And each cross here is the average yearly change between 2015 and 2019. To some extent, we can interpret this as the potential gain if countries were to follow the same trend 5 years prior to the pandemic. On the left-hand side, we observed life expectancy losses for most of these countries, and most notably for males in the United States, with losses larger than 2 years between 2019 and 2020. We can also observe that Lithuania, Bulgaria, and Poland and Spain suffer quite substantial losses of life expectancy. And in the other side, we can see, for example, countries like Norway, Denmark, and Finland that did not experience losses in life expectancy, and they might have even increased slightly life expectancy during 2020, which speaks also to the different strategies implemented across all these countries in terms of, for example, testing, non-pharmaceutical interventions, and vaccination programs during 2020. And then you might ask me, okay, Jose Manuel, but how big is 2 years of life expectancy? How big is this change? It's not uncommon that sometimes life expectancy goes down. And I would agree with this, but the reality, or at least historical patterns, show that life expectancy fluctuates, but it tends to increase. There are, however, some exceptions. For example, in Eastern Europe, after the dissolution of the Soviet Union, many of these countries experienced quite substantial decreases in life expectancy, most notably, for example, Russia, with the largest life expectancy loss among males in the Soviet Union. And also, there was a strong flu season between 2014 and 2015, which is depicted here by the yellow dot, which was regarded as a massive shock in mortality. There was a paper published in the British Medical Journal documenting this, and it was quantifying how much did countries, high-income countries, lost in terms of life expectancy. And it was all over the news, and it was one of those papers that was really surprising to see these life expectancy losses. In that paper, the largest loss that was documented was in Italy, and it was of half a year. If we put into context what we have documented for the COVID-19 pandemic, which is this green color, we observe that most of these countries that were also exposed to this strong flu season back then lost in excess 2 or even 3 times even more than what was experienced in 2014 and 2015. So this also kind of puts a stop to this narrative of, for example, that the COVID-19 is just a flu. It is not a flu, and these graphs show essentially that the massive impact is quite unprecedented in recent history. So the last time we observed these declines, or these magnitudes of declines in life expectancy, go back, for example, to the fall of the Soviet Union, and also to the World War II, for example, in many Western European countries. So like I said, demographers are interested in trying to explain or describe what drove these changes that we documented. So which age groups were the ones responsible of these declines? And this graph shows the age-specific contributions to the decline in life expectancy between 2019 and 2020, and also what was the increase or which age groups drove the increase between 2015 and 2019 in purple. So everything that is positive means that they contributed to increasing life expectancy, and what is negative, it means that they contributed to decreasing life expectancy. And here we see a variety of countries, but I can highlight a couple of them. So we can highlight, for example, Spain, where the losses of life expectancy were highly concentrated in mortality above age 80. We can also see, for example, United States, where similarly to Spain, 80 plus group was the one contributing the most in comparison to the other groups. But we also observed quite a substantial contribution to declining life expectancy in working age individuals, which is quite surprising. Another atypical pattern would be, for example, Bulgaria, where most of the losses in life expectancy were concentrated in ages between 60 and 80. And on the other hand, we have these countries that were quite successful in controlling the COVID-19 pandemic, where we see barely losses or even increases in 2019 and 2020 in some of these age groups. Now, patterns, as we would expect, between females and males are different. So this graph shows the same results, but now for males. So here the darker green shows the contribution to increasing life expectancy or changes in life expectancy between 2015 and 2019. And the blue shows the contribution to the loss in life expectancy between 2019 and 2020. And here, one of the biggest examples is the United States, because most of the decline in life expectancy was driven by increases in mortality below age 60, which challenges what we knew previously about how mortality was going to increase exponentially with age, similarly to a usual pattern of mortality. In the United States and in many countries, we see substantial declines in life expectancy due to midlife ages. And here we can also highlight Scotland, where between 2015 and 2019, individuals below age 60 were already contributing to declining life expectancy, offsetting the gains from individuals above age 60. So I think this also underscores the variety in how age groups have contributed to these changes in life expectancy in the last years. Like I said, we are also interested in quantifying to what extent these changes were due to specific causes of death. Now, for 2020, information in causes of death is probably just coming out for some countries. So we focused only on two big causes of death groups. One, official COVID-19 deaths, which I have to say they need to be taken with caution because of different ways of classifying deaths. No, they vary by country. Not all of them had the same strategies in coding practices. And then in the lighter colors here are shown the rest of mortality, so the other causes of death. So what we found is that most of the declines that we observed were, as we were expecting, by official COVID-19 deaths, but we also observed this pattern, like in the US, in some countries, that also other causes of death contributed to declining life expectancy, both in females and males. And what this means is that the COVID-19 pandemic has affected also through indirect pathways, other causes of death. So, for example, it is likely that some diseases that needed some treatment were not treated because the healthcare was overwhelmed. It is also, there was also documented that some people did not want to go to the hospital when they were feeling ill because of fear of getting COVID-19 in their visits. So this might have exacerbated also mortality from other causes of death in 2020 in some countries. So the key point to summarize this paper is that out of 29 countries that we analyzed, 27 had losses. 11 countries for males and 8 among females had in excess of 1 year of loss of life expectancy, which is, like I said, twice already of the maximum documented during the strong flu season in 2014 and 2015. And linking to this, females from 15 and males from 10 ended up with lower life expectancy at birth in 2020 than in 2015, which, like I said, was already regarded as a year that was affected by this strong flu season. And losses in life expectancy were largely attributable to increased mortality above age 60 and linked to official COVID-19 dates. Another interesting dimension of this is sex differences. So previous research suggests that females tend to survive better under mortality shocks, including epidemics. What we observed is consistent with this. Most of the countries that we analyzed, males experienced larger losses in life expectancy compared to females, but not everywhere. There were some exceptions, very few exceptions. So as data has become more available over the last couple of months, we were able then to also quantify the life expectancy declines in Russia during the COVID-19 pandemic. And this is something that will be released today. So this is completely new work from our side that I'm showing in today's seminar. So similarly to the other countries where we found, so this is the trends in life expectancy from 2015 to 2020. So from 2019 and 2020, females in Russia experienced a loss of life expectancy of 1.8 years and males of 1.7 years, more or less. And these losses were driven predominantly by mortality below age 80, with a strong contribution of the age group between 60 to 80 years. So what is interesting about Russia, there are two things that I find completely interesting in the Russian case. And one is that Russia was, after decades of stagnation in the 60s and 80s, and then sharp decreases in life expectancy after Gorbachev's anti-alcohol campaign, but also after the Soviet Union dissolution, the increases in life expectancy in Russia were like very fast. They were improving quite fast. They were reducing cardiovascular diseases very fast. And still we see the sharp decreases in 2020, which might compromise all that progress that has been made in the last decade, for example. The other thing that is notable in this country is that this is in Russia is where we observe the largest losses among females, even compared to males. So this graph shows the sex difference in years in the life expectancy losses. So in the right-hand side, we have countries including Scotland and the US, where life expectancy was lost predominantly among males when we compare to females. And very few countries, we observe the reverse pattern. And in most of these, the difference is not significant with large confidence intervals. The only country in which we found, the maximum difference between losses in males and females and that are significant from zero was in Russia. So I think this also speaks to the vulnerability that females have experienced in many of these countries. We can speculate that this decrease in life expectancy among females in Russia may be driven by the heightened risk of, for example, healthcare workers who are predominantly females, but also lack of vaccination uptake, and also the fact that interventions against the COVID-19 pandemic were not prioritized during 2020, especially because it was elections season. So those are the studies that we have been working during the last year, but I think a lot of this work also opens questions to what is going to be the role of the demographers in the short, medium, and long term in aiding our understanding of the COVID-19 pandemic. So for example, it is known that during this sharp crisis, mortality tends to go back to the level quite fast. So it is expected that in many countries, life expectancy might go back to the trend that we observed before the pandemic, as we saw in the past. But I think this is still quite an interesting question because more evidence is coming out about, for example, long COVID and its effects on long-term population health. It might be also important to analyze what's going to happen in the medium term for those individuals that, as I mentioned, for example, there were cancer treatments that were stopped during the pandemic because of the overwhelmed healthcare system. So how is this going to affect mortality in the medium and long term? Is it really reasonable to think that life expectancy will go back to levels that we observed before? Will life expectancy keep dropping in 2021? I mean, these are likely scenarios. No, we have countries, especially those that might have been even hit the most by the pandemic, including, for example, Brazil, Mexico, many Latin American countries that were the epicenters at some point of the pandemic. They might be decreasing life expectancy also in 2021, given the lack of access to, for example, vaccination programs. So now in the UK and here in Denmark, we're already talking about the booster shot, the third shot, when in many countries, the population have not even been able to get a first shot. So there's also inequality in this cross-national perspective, not only reflected in life expectancy losses like we show, but also in what could potentially stop these losses in life expectancy. Another interesting question, and this is, I think, more important for larger countries, is that emerging evidence from, for example, Brazil, Mexico, and Russia suggests that there's many variation or very large variation in terms of life expectancy losses at the subnational level, in the sense that many regions will and have experienced quite sizable losses in life expectancy or mortality shocks compared to the national average, for example. So I think there is also scope from ourselves to analyze this and integrate this into our analysis. Another dimension that we might want to think about now that maybe data will become available is how are we going to include causes of death? And demographers have been also quite interested in this question because we like to think about causes of death in a competing risk scenario, which means that while COVID-19 deaths or COVID-19 attributable deaths will be predominant in terms of what has caused the excess mortality, it is also true that other causes of death may have been affected in a detrimental way, like I mentioned, cancers, for example, but it is also likely that other causes of death were decreasing during the pandemic, including, for example, accidents or external mortality in general. So these three questions are some of the work that I wish and I hope I can do in the future. And I hope this also provides good food for the discussion and questions, along with this, what is the role of demography in aiding our understanding of the pandemic. Thank you.